At Lickstein Plastic Surgery, we've really tried to learn from our years of experience. We've rethought the approach to how we deal with patient consultations and even how we're designing our new website. More and more patients have concerns. My breasts are too small, my breasts are too big, more than knowing exactly what they need. So we've tried to approach it in that manner. As for people who feel their breasts are too small, one of the things they might consider is breast augmentation. And I wanted to take a minute to show you what a breast augmentation consultation is like in our office. You're greeted in the waiting room, and you'll be brought into our consult office. The most important step in the consultation is really listening. We need to know your medical history and understand what your goals are. And that takes some time for you and I to develop a rapport and really understand each other. But most of my time is spent listening. I found that over the years, if you listen to patients, they'll keep telling you exactly what they're trying to achieve, and then you can help figure out what the answer is. Patients are usually really surprised that they have a lot of choices. We'll then move to an exam room. We'll be able to look at your anatomy. That'll help me be able to make a better recommendation for how to achieve your goals. We'll come back in the room and we'll be able to sit down and look at pictures and look at all the different kinds of implants. I think one of the most surprising things to patients is that they have a choice of implants. They have a choice of size. It's not for me to recommend to you. I'll help guide you to what might be a good or bad solution, but it's really about the photos you show me that you like and the proportionality and size you want to achieve. Personally, I believe that some of the best results come from respecting the proportions of your body. I think women should look good in work clothes and not attract a lot of attention, but also be able to look great in a bathing suit when they want to. We use a lot of different silicone implants, and they come in different projections, from very flat to very round, and different fills. Companies are now altering the amount and thickness of the silicone that's in the implant to help the different properties and how well they hold their shape. There's some new saline implants that hold their shape well and even mimic silicone implants. And there's some differences between them, and we're able to talk about them and go over them to help figure out what will best meet your goals. We take pictures of you, and we can sit down here using TouchMD and look at the pictures together. This is really incredible technology that provides a lot of information about the procedures, lets you look at before and after pictures, and lets us look at your pictures and draw on them to figure out what will work the best and show you exactly where we would place an implant and the effects it might have on your body. People are amazed at how natural the results can be and how long-lasting they can be if the surgical plan is a good one. It really takes years of experience and doing a lot of operations to figure out what's the best option for most patients and how to give them the best result. Using the technology, we're actually able to draw on the picture and show people exactly what an implant might do, where the muscle is that we place the implant beneath, so that they can see it, and it really helps bring it to life. Understanding where the implant would go and how it works in them, the effect that it might have, and the change that can be seen. I think the most valuable thing in trying to figure out how to achieve the result is really patients showing us guide photos. It's not important to me if a patient can pick the exact size implant, but if they can show me a series of pictures of the look they're trying to achieve, we have enough implants made now that I can find the right implant to give them the look that they want.